Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician and Chief Medical Officer of Good Samaritan Physician Network. Joining me with always, Adam Thacker, who's a pharmacist, answers all the tough questions on medicines and vaccines, and also our Chief Operating Officer of Good Samaritan Hospital. As usual, we will be talking to you about current statistics, what's been happening lately in our community as far as trends, of course, what's been going on with vaccination, and also kind of what we see happening over the course of the next few months. Most importantly, looking at total numbers, around 168 patients since the beginning. But the numbers that we look at most closely every week are really what those positivity rates are. So positivity rates for all individuals, somewhere around 6.5%, but for unique individuals, 13.5%. And those numbers are reflective also of kind of where we're at in terms of positive cases in the community, because we've seen a rise over the course of the past few weeks or so, and then a little ebb and flow kind of back and forth. But certainly, probably the most important thing that we're going to talk about today is what population is getting infected right now, and what are we seeing happening with those patients.
Yeah, much like it's being reported around the country, what we're seeing is a younger population. The average age in late 2020, when we were really seeing a big surge of patients, was 60 and older, high risk for extended illness, hospitalization, and potentially poor outcomes. And now we're seeing a population that our last couple of weeks, average age is 26. So certainly a different demographic of patients that are contracting COVID and having are active cases and are having illness. And a lot of it ties back to vaccines. So our 60 and older population that from a year ago was at the highest high risk, a lot of concern with those negative outcomes, really stepped up, got vaccinated at a very high percentage. We're seeing 70+% in Indiana of those populations getting vaccinated, and thus they're not ending up in the hospital. Very few are even being reported as positive cases that have any symptoms to speak of. So certainly seeing that population now shift into that 20, 30, 40-year-old population where uptake of the vaccine has been significantly less. And unfortunately, with that comes the risk of contracting COVID because the virus is still out there. It's still being transmitted based off that 13%. We would consider that sustained transmission. It's low. There were times we were in the 30s. Right. So we look at 13 and there's, some good to be taken out of that it's still low, but there's also still that risk that it is active transmission going on in the community, and we have to continue to maintain our public health measures with hand hygiene and masking indoors, especially distancing. Not feeling well, then stay away from events and those types of activities, and just being cognizant of that. And then certainly put the plug in that if you have not been vaccinated, look on the ourshot.in.gov site, find one of the vaccine clinics, sign up, and we would encourage everybody that is eligible, which would be 16 years of age and older, to get vaccinated.
Yeah, and certainly one of the things that Adam pointed out there at the end was that the population that we're seeing contract the illness now, a couple of things are happening with one. Number one, they're not recognizing their symptoms early on. Right. And so they are continuing to work, they're continuing to stay plugged into society and spreading that virus around. And so, as you said, we've seen single digits numbers about a month ago as far as active cases in the community, and now climbed back up into the mid-20s, low 30s over the past couple of weeks or so. And what we're seeing on the clinical side is younger individuals who are getting sick, continuing to kind of gut it out and work through it, and then coming in to see us 1 or 2 weeks after their symptoms have started to get their diagnosis. And the unfortunate thing is during that period of time, they're not necessarily pulling themselves out of society and isolating themselves. So very important to realize that we still have active transmittable disease in the community, and to continue to use those precautions. Likewise, it's important to identify your symptoms early on, get yourself tested, and then we have an abundance of the antibody infusion that's been given. Now, there was a little bit of a shift in that over the course of the past month or so, and that was to change what infusion that we're using. So that changed. We've now been administering that, about 17 of those, you said, over the course of the past several weeks, but talk a little bit about what that means and why.
Yeah. So the why behind the shift in the monoclonal antibody treatment and really what we're seeing in the community is because from a medical standpoint, most believe that this is the UK variant, the B117 variant. So we were using bamlanivimab as a single monoclonal antibody. What has came out now is a combination product. So it's bamlanivimab and a second MAB that gives us better protection against the new variants. So as we've made that shift, the single-use bamlanivimab is no longer even being used from an FDA approval standpoint. And that really tells us on the medical side that that's because the UK variant is becoming the predominant strain of COVID, and that was anticipated months ago. And now we're certainly seeing that. That's also why in this younger population we're seeing cases pop up, because that variant is considered more transmissible than previous variants, and it can cause severe illness. Luckily, our older population is pretty highly vaccinated because this variant is expected to be more virulent. So it is hospitalizing a younger population that are otherwise healthy. Good news, vaccine works equally effective against this variant. There's been news out there about other variants that have what are called escape attributes and are able to evade some of the vaccine protection. This predominant variant does not. So getting vaccinated protects you against the original strain as well as this strain that we're seeing kind of emerge as the main culprit in new cases. And then with the monoclonal antibody combo therapy, as you mentioned, getting tested early, identifying symptoms, and that treatment to keep those that potentially would progress to hospitalization, keep their symptoms minor and recover at home.
Yeah, and so the question that we all get on a routine basis is, well, I'm 35 years old, I'm 40 years old. What's the big deal? Why do I need to go get the vaccine? And really the most important thing to look at from a population health standpoint is reducing the risk of continued transmission within the community. But from a personal standpoint, what we see is individuals that are off work for a couple weeks, and it's impacting them, it's impacting their families, it's impacting their children. And so it's important to realize that it's still extremely important to continue with the vaccine program. And as Adam said, tremendous success in the population that's 60, 65, 70, 75, 85 in reduction in risk, reduction in cases. Those individuals feel safer now than what they did a year ago. And so we're very fortunate that that has gone so well. But we would just encourage everybody to continue the progress that has been made with regards to the vaccination program and respect the fact that your risk is reduced tremendously. So you were quoting some statistics for me looking at what if I'm 40 years old and don't get vaccinated versus get vaccinated.
Sure. Yeah, and that's what it all comes down to is risk benefit, and it's easy when you're a healthy individual to say, even if I get the virus, I feel like I will be fine, so I'm not going to get a vaccine that's been approved through emergency use. But as you look at some of the true risk calculations, so taking average 40-year-old healthy individual, the risk of getting COVID, if you contract COVID, the risk of being hospitalized and having severe illness is about 3%. So not a real high number, 3 out of 100, but still it's a relative. There's a risk there. If you are fully vaccinated, that same 40-year-old, otherwise healthy individual, the risk of becoming severely ill and being hospitalized, which a very small percentage will, is 0.0008%. So there's about a 3,000-fold increase in risk of being hospitalized if you contract the virus versus if you get vaccinated. And so that's really what you have to look at is risk benefit and which is more of the risk, which is more of the benefit. And certainly what we're seeing, vaccine has been safe and effective. Obviously we can talk about the J&J vaccine pause, but all three vaccines, very safe, very effective, and the side effects that you see from those are normal and in line with typical vaccines. Even when you do have those individuals that feel pretty poor for 24, 48 hours, they recover, get back to baseline, feeling normal. Those individuals that contract COVID end up in the hospital are weeks to months of recovery. And we know some individuals that have had COVID 6 months ago and still talk about some symptoms that are kind of lingering. They're called long haulers, long COVID. They have a PASC abbreviation now nationally for it. So certainly from a medical standpoint, the vaccine seems like the benefit route versus the risk route of contracting the virus and just expecting that you'll recover normally.
Yeah, and getting vaccinated has really never been easier. The open slots that are available both at our facility here, which is the Pfizer facility, at the health department, at the United Community Methodist Church, tremendous availability right now. The state is open for other individuals to come from other states into Indiana to get vaccinated. So availability is great. Safety has really not been a concern. We've over 23,000 vaccines have been given. I have had thousands of my patients that have had it and have had zero problems. The only individuals that we have seen much of a reaction in are those that potentially had COVID 3 to 6 months ago, got vaccinated, and usually by their second dose, they have more of a reaction, just like you said, a little bit more of a sore arm, a little bit of a low-grade fever, maybe fatigue, so forth. But that's just a sign that their immune system is spooled up and ready to go. So we really encourage people to continue with the progress that has been made. We are all ready to be done with masks. There's no question across the board, but organizationally where we are, many companies within Indiana will continue to mask out of an abundance of caution. That being said, when people are outdoors, when you can socially distance, masking removal is perfectly fine right now. Right. But a lot of individuals have asked me, what's the timeline? What are we looking at here? And basically, until we can see those numbers stay down in terms of what our percentage positivity rates are and get away from sustained community transmission, we're going to be masking for a while still.
Right. We lead off every session with the statistics, and that unique individual 13.3%. Most of what you see from CDC guidance and World Health Organization guidance is less than 10%. Sustained number less than 10% really shows that there's minimal to no ongoing active transmission. So we're looking for that.
And we were there for about 10 seconds, I think.
Yeah,
we were down in the Blue County range for, I think, probably a week and a half or 2 weeks or so. But that's really what we're looking to get back to. And as we have seen over the course of the past week or so, the state's turning a little bit more blue again, our surrounding counties as well. But we want to see that, and we want to see that stay that way for long enough that we can feel confident that the number of individuals who've been vaccinated, the number of individuals who've had the illness reaches closer to that herd immunity level, and then we don't see that sustained transmission anymore.
Right. And I know we're putting a lot of plugs in for getting vaccinated because that older population that has really taken that action is seeing the benefit of it. We're not seeing them in the hospital. We're not seeing them get ill. One thing that we didn't mention about the vaccine program, and I think we often overlook it, it's free. Mm-hmm. So the federal government has really stepped up, purchased the vaccine that's being allocated to states and then allocated out to vaccine sites across the state. And certainly here in Indiana, the number of vaccine clinics that are open and the availability to get vaccinated is a very positive note for the state. You can easily get vaccinated next day or within the same week with traveling within an hour. And in many cases, it's much less than that, but within an hour. There are some states that do not have that luxury right now. And in talking to peers that are still looking at it being open to all adults and still seeing limited number of vaccine where they're having to drive multiple hours. So inconvenience is not really a good reason not to get vaccinated at this point, and cost factors have been removed as well.
Yeah. So as we move throughout the remainder of the spring and into the summer, a lot of people are asking questions as to what we're going to see in terms of activities, social events, things like that. Obviously, with the mask mandate being pulled back in Indiana, there have been a lot more events that have been happening lately. Weddings, festivals, we fully intend to see that continue throughout the course of the next several months. Excuse me, school's going to be winding down over the course of the next month and a half as well. So we want people to continue to make plans as to what their events are going to be and choose wisely as to what that's going to look like and how your population that's going to be participating in that are protecting themselves. So again, continued hygiene efforts, just like we have discussed over the course of the past year, masking in close proximity when social distancing is not available, and then again, just an abundance of caution looking at how those things are going to be structured. Outdoor activities always better than indoor activities.
Right. And I think we're very fortunate in this region, this area, seeing that there are activities being scheduled, and certainly that focus on outdoor where possible. But being realistic, things are going to look different. Even though there are not capacity limits and the mask mandate is now a mask advisory, large events with a board or group, a planning committee that are putting those together have to be cognizant of safety of all of the individuals. So attendance may be limited in certain areas. Vending and food and those types of things may look a little bit different. And I think we've got to recognize that that's a reality of what this summer is going to look like to be able to have those events, because the alternative is just simply not having them. But our committee, those committees and community leaders that are making sure that those events happen for this community and continue to push things back to a sense of normalcy to some degree, are looking at that at every angle and making those decisions. And as we've talked many times, this region's been very fortunate in the events that we've had, the in-person school. It's within this month that I have peers in other areas that children are returning to school for the first time in over a year. And we haven't had to experience that. And all events, just completely shut down. So we need to also look at it and say we're fortunate to have events, even if they're going to look a little bit different.
Yeah, absolutely. Any other things we need to cover before going to the phones?
I don't believe so.
Tiffany.
You already touched on this a little bit earlier, but someone asked about the effectiveness of the vaccine with the new variants.
Sure. So the 3 vaccines have all been tested against the 2 variants that are most widely seen worldwide, and the B.1.1.7 UK variant, which is becoming the main strain in the United States, same effectiveness as against the original strain that the vaccines were created against. So Pfizer, Moderna, Johnson & Johnson all have over a 95+% effectiveness in keeping individuals out of the hospital. That varies a little bit with each of those and what may see some mild illness, but still highly effective in keeping individuals out of the hospital, which is what we focus on the most. Now, there are some other variants that those efficacies drop off a little bit, but even in those cases, the efficacy that may be reduced with, let's say, the South African variant that's been some concern, which drops down to 60-70%, flu's 25-30% on good years. It's still highly effective, and again, risk benefit, it is much safer and more effective than contracting a novel virus that your body doesn't know how to respond to, and potentially being hospitalized and having some long-term side effects from that.
Okay, those are all the questions.
Outstanding. Well, thank you all very much for being with us. We will again join you in a week for an update. Be safe.